Good morning. I understand that state law currently requires that the following announcement be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, City Council committees are currently meeting remotely. We are using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing and the public hearing notices that are published in the Daily News, the Inquirer, and the Legal Intelligencer prior to the hearings, and can also be found on phl.com. I now note that the hour has come. Clerk, will you please call the roll to take attendance? Members that are in attendance will please indicate that you are present when your name is called. Also, please say a few brief words when responding so that your image will be displayed on screen when you speak.
Councilmember Heenan. Councilmember Heenan. Councilmember O.
Present, and good morning, everybody, Chairwoman and colleagues.
Councilmember Gim. Councilmember
I'm present.
Councilmember Green.
Good morning, President. I'm looking forward to a good hearing today.
Councilmember Thomas.
Good morning, everybody. Good morning, colleagues. Looking forward to a good hearing today.
Councilmember Brooks.
Good morning, everyone. I hope everyone is having a great morning.
Okay, thank you. A quorum of the committee is present and the hearing is now called to order. This is the public hearing of the Committee on Public Health and Human Services regarding Bill number 200306. And clerk, will you please read the title of the bill?
Bill number 200306, an ordinance amending Chapter 9-4100 of the Philadelphia Code entitled Promoting Healthy Families and Workplaces by adding new definitions and requirements to ensure that certain healthcare employees are compensated for lost wages and medical expenses in the event they contract a communicable disease at work during a pandemic or epidemic event, all under certain terms and conditions.
Before we begin to hear testimony from the witnesses we have for today, everyone who has been invited to the meeting to testify should be aware that this public hearing is being recorded. Because the hearing is public, participants and viewers have no reasonable expectation of privacy. By continuing to be in the meeting, you are consenting to being recorded. Additionally, prior to recognizing members for the questions or comments that they have for the witnesses, I will note for the record at this time that we will use the chat feature available in Microsoft Teams to allow members to signify that they wish to be recognized. In order to comply with the Sunshine Act, the chat feature must only be used for this purpose. Before we begin and call the first panel or witnesses, I believe that the bill sponsor, Councilman O, would like to make comments. Chair recognizes Councilman O.
Madam Chair, before the councilman gives his statement on his bill, I just want to be recorded as present. Thank you.
Thank you, Vice Chair Bobby Heenan. Bobby Heenan is present. Thank you. Councilman O, you are muted.
Thank you very much. Can you hear me now?
We can hear you now.
All right, thank you very much. Okay, so let me say that this bill is overdue. It's overdue for a lot of reasons, mostly dealing with COVID-19, just the way we're operating, having to do things remotely. I served on the board of 2 hospitals, and so I know a little bit about healthcare from that perspective, just a little bit. But I was surprised, quite frankly, I was shocked when we began to deal with this pandemic here in Philadelphia, COVID-19. And how I first learned about the problem was through a friend, like many of us. I was talking to a friend, and she began to tell me what was upsetting her. In fact, I think she called me not looking for help as a legislator, just talking as a friend. She's a nurse. I knew that. What I didn't know is she's a per diem nurse. She's a pool nurse. I didn't know that there were so many of them. I didn't know it was common in the profession. I didn't know that, for example, one of our hospitals here in Philadelphia has about 450 pool nurses. And what she told me was that she was thinking about not going to work, and it was really bothering her because she wanted to be on the front line of COVID-19, but at the same time, she has young children, and she cannot afford to be out of work without wages, having to pay for her own medical expenses, not being able to pay for her health insurance premiums, and I was surprised to hear that. And for those who have told me things like, oh, they have workers' compensation, here is the problem. If there's an emergency in Philadelphia, like an earthquake, let's say, or a hurricane, you know, people go to the hospital and the nurses and healthcare staff, they treat them, but they're not going to catch a broken bone. But when we're dealing with a highly communicable disease, a virus like COVID-19, and they are in the hospital with the most sick patients, intubating, putting tubes in, IV, opening up their lungs, being in that room, hot and sweltered, you know, reusing masks, and all that kind of thing, they're at great risk. And the issue is that if she gets sick, and anyone in her situation, will she be covered? Because she will not get covered for what lost wages. And the issue is, did she get it, COVID-19, out on the street, or did she get it in the hospital? Because you could get it anywhere. Mm-hmm. And how long will she be out? Like, you get symptoms, you may be asymptomatic and have COVID-19, so you need isolation, then you need recovery, you need treatment, and it could be 6 months, it could be a year. So after that conversation, I drafted a bill to try to deal with this as best I could because of this. While we were trying to find more bed space, while we were looking at the convention center, possibly reopening Hahnemann University, the problem was, even though you create all those beds, who are the professionals that are going to, you know, serve? And so beyond the pool nurses, all the other healthcare people that are not covered, part-time workers, full-time workers, we've had most of our deaths have occurred in senior nursing homes. And for people who aren't covered, they don't want to come to work, or they're weighing not coming to work. There are lots of people who if they flood our healthcare system, eventually will not be able to be treated. And so this is a small thing, but I think a very important thing. And I've spoken with different people, and I know from reading the testimony, and I'll put this on our deputy mayor, Rich Laser, that he says, well, let's work on it. To me, I would say this: when someone is calling out for a life preserver, the answer is not that it needs some new paint and a new rope. Throw the life preserver, because if we pass this out of committee, if we vote it out of committee today and waive first reading, we can put it on the floor and possibly pass a law before this term is over. If not, we will be going into September, and I don't know, because people, our healthcare workers, need protections now. There are other solutions, and I know in particular, Councilmember Kendra Brooks has a bill that she's put. I think it's very well supported, much broader than mine. And my point, it's not either or. You can have both. And if another bill comes out that supersedes my bill, that's fine. But I would say that the issue is to get this out now as soon as it can be done. And with that, I will say that what this bill does is provides for lost wages because of the communicable disease, COVID-19, for example, during isolation, treatment, and recovery. and during the time that the employee is not able to work. In addition, it requires that medical expenses be paid related to the communicable disease, or that the healthcare provider provide medical treatment at no cost. That's the sum of it. And so with that, I will end my statement. Thank you very much, Councilwoman.
Thank you, Councilman O. And I would also, at this point, would like to recognize Councilwoman Kendra Brooks, who has remarks. Councilwoman Brooks.
Thank you so much, Madam Chair. And I just want to say that I'm proud of the dedication of the council body to showing for essential workers. This issue is very important to me because I am a former healthcare worker, which is why I also wrote a bill, as Councilmember O talked about, expanding paid sick leave for essential workers. The public health emergency leave that I introduced would not only cover healthcare workers, but also include grocery store employees, domestic workers, sanitation workers, and those who work in the gig economy and others. That bill is slated to have a hearing on June the 22nd. It is challenging to fairly provide this bill. We're not looking at paid bills side by side. I do have some reservations and questions about Councilmember O's bill, primarily because it does not cover, and I mean, it covers only a small number of workers. And I realize that all workers in public-facing roles need protection. And when workers are safe, and we need to keep the public at large safe. So, I thank Councilmember O for the work that he's done on this bill. And I thank you, Madam Chair, for bringing both bills together. But I do feel that we need to think about how we're rolling out both of these bills at the same time and make sure that we're including more Philadelphians, or as many Philadelphians as possible, in the event of a resurgence of COVID-19. Thank you so much.
Thank you for your comments. Thank you so much. Chair now recognizes Councilman Derek Green for comments.
Thank you, Madam Chair. I want to thank Councilman O, Councilman Brooks for their statements. I understand the perspective that both people have provided in reference to legislation they put forth. But at the same point, this is legislation that's before us now. I actually was not going to speak on this bill and just was going to listen to the testimony from the various people that were testifying. I also saw Councilman O's amendment this morning. I wanted to ask some additional questions to the administration, whether they are supportive of the bill now in reference to the amendment. But as I started to think about this legislation, I had to reflect on the fact that I have a niece that went through COVID-19 who was a healthcare worker. And the fact that she was at a position that she felt that she, one, was in an unsafe workplace to begin with, contracted COVID-19, and then as soon as she recovered, and she had very violent spells of throwing up blood and was in the hospital for a period of time, she felt that she had to go back to work. And she even felt that even prior to, during the whole beginning of the COVID-19, and the fact that they did not have the sufficient PPE equipment at the facility where she was working at, a healthcare facility, that she may possibly lose her job. So I understand the concept of looking at all the legislation, but I'm looking at this legislation now. Our last session of council is June 25th. I don't know what the future may hold, but I do know that this bill is in front of us now at this time. And so from that perspective, when I think about all of the people that have been impacted by COVID-19, not just me at a personal level, but others who are on the front line, who are in the health facilities, who are trying to care for people in nursing homes, and others who contracted COVID-19, I think the urgency of this legislation is now. Thank you, Madam Chair.
Thank you, Councilman. And Chair now recognizes Councilwoman Gim for remarks.
Thank you very much, Madam Chair, and good morning, colleagues, and good morning to the public. I, again, want to echo Councilmember Brooks's statement that all workers are essential. Sorry, I don't know an echo here, but all workers are essential right now. And one of the things, for example, that we're hearing tonight is a need to actually do an anti-retaliation bill for workers who are even raising questions about COVID-related following mandated public health orders, COVID-related practices, that kind of thing on the workplace. So it is really important that council sends the message that if you are an essential worker, your life is valued, as healthcare workers are, for sure. But there is concern that, for me, that I would like to see the bills considered together. I know that the council member has a bill before this committee, council member Brooks has a bill before the committee, and it would be helpful just to have had a little more time to review and see if we can match those bills up so that we craft the best piece of legislation and not a hasty piece of legislation. So I want to thank the committee for that, and I will also be looking forward to public testimony on this issue, particularly from our labor advocates who are on the front lines of this. Thank you, Madam Chair.
Thank you, Councilwoman. And seeing that I don't see anyone else's hand raised from the committee to make a comment, I'm going to ask the clerk to please call forward the first panel to testify.
Monica.
Yes. Okay, please, I'm sorry, I lost my place here. Okay, ready to proceed. Please state your name for the record and begin with your testimony.
Yes, I am Monica Harmon. Thank you, Madam Chair, Public Health and Human Services Committee members, and to Councilman O for such an auspicious invitation to speak on behalf of per diem healthcare workers in support of Bill number 200306. I have been a proud professional nurse for 2 decades. My specialties are public health and nursing education. I am the current chapter president today. Thank you.
Thank you for your statement and testimony. And I'm very familiar with the Black Nurses Association for many, many years. A good friend of mine, Pat Andrews, who was very active for a long time with that association, You guys do great work. So thank you so much for being here for your testimony today.
Thank you.
Are there any questions for this witness? No, and I know that Councilman O. You do have a question, Councilman O.
Thank you very much, Chairwoman. First of all, it's our first time meeting through Zoom or whatever, Google Meet. Thank you very much. I want to say one of the things that I was really taken aback by was that when I've spoken to about 35 nurses and healthcare workers who talked about the lack of PPE, who talked about putting a surgical mask in a sandwich bag and having to reuse it again and again and again. And about what you just talked about, the fear of getting a disease that will take them out of work, possibly, lead to their death. And not even having the little bit of comfort that to know that their medical expenses and their wages will be covered, but not one of them wanted to publicly say that for fear of losing their job, for fear of retaliation. And so I really appreciate you stepping forward in your position of leadership. And could you comment about that? I find it, really disturbing. Thank you.
Thank you, Councilman O. So the idea of seeing nurses go against how we've been trained is very jarring to me. We've always been taught that you use PPE and that you treat everyone as if they have some kind of infectious disease. It's called universal precautions. And so to see now that, nurses and other healthcare workers have to reuse supplies that really are meant to be used for a small amount of time while you're providing care, whether it's wound care or other care that would put you in direct contact of infectious agents is disheartening to me. I would say that.
And then my last question, because this is on our nation's mind, if not the world, is there a level of structural bias, racism, discrimination that is built into the healthcare system? Could you comment on that?
Well, Councilman O, you've opened Pandora's box with that question. So certainly, there are issues. If you look at the numbers of healthcare workers, so nurses are about 50% of the healthcare workers across the board. When you start to look at the racial breakdown of that, you will find that Black nurses in particular are about 9 to 10% of those nurses. And then when you look at education and you look at the academic and the professional pipeline, you will find that those numbers decrease even more. So when you talk about structural racism, the idea that people like myself have gone into rooms of patients and they said, honey, I want the nurse. And I have to say, well, you got her. And they kind of look. So it's almost like they don't understand that, yes, we too can be nurses. And when you look at Blacks and other social and ethnic minorities, we also tend to be more educated once we get into nursing as well. But yet we have to fight sometimes for people to understand that we do come with a knowledge base and skills.
Thank you very much for that. I'll just relate that when I was in the district attorney's office, when I would show up to court, they would say, the translator has arrived. So I know what you mean. All right. Thank you very much, Madam Chair.
Thank you very much. Thank you, Councilman. Chair recognizes Councilman Derek Green for a question.
Yes, thank you for your testimony, and your last name was very poignant because it made me think of my Aunt Margie Newland, who was our last family member on my mother's side to come here from Barbados, and she was a nurse, and she had a chance to travel all around the world. And some of the things you talk about, some of the discrimination that she suffered and dealt with, is things that we are familiar with. In fact, on my mother's side, one of her great nieces is a nurse practitioner in Maryland. And so we do family calls every other week on Saturdays, and often she can't participate in some of those family calls because as a nurse practitioner, she is doing double duty on evening shift because of COVID-19 to help out on different locations, and then she has a normal job during the day. And so the issue you talk about, discrimination and the fact that nurses are often not treated at a level they should be, and in fact, even nurse practitioners are nearly a physician, and my sister's a physician, and she will also make that same statement. But I'm curious now in reference to what you're seeing now in facilities, healthcare locations. PPE is still an issue. When you talked about having to put masks in a bag to bring with you and rewash and reuse, is that still an issue going on in the facilities that you're seeing? And was there any type of discriminatory access to PPE equipment, especially for nurses?
So I think we still are seeing some of those practices going on. And I think that because nurses, we always think about prevention and we think about how we're best going to care for our patients. Nurses do still carry their own PPE just in case. So that doesn't, it doesn't stop. In terms of the structural racism or even just the structural disadvantages to nurses in particular, I think what we're starting to see is that the healthcare team is realizing that it is a team, right? So it's not that you have these hierarchies that we have where the doctor is at the top of the food chain and everyone else kind of falls in line, but really we're all working together for the health of our patients. And for me, that's actually a positive, if you will, from this pandemic.
And are you starting to see an increase in nursing, especially based on your position, by African Americans and other people of color? I'm reflecting on a friend of mine from college who's actually a professor in nursing up in New York, who's from Philadelphia, went to Girls High, went to UVA with me, graduated sim class, and then she decided to go nursing, got a master's degree in nursing from Penn, and now teaches in New York. In fact, her daughter just recently graduated from college and just got accepted to nursing school. So that's the second generation of African American nurses. But are you seeing more or less people, especially African Americans, men or women, coming into the nursing profession?
So I'm definitely starting to see more people of African descent. And I say that because not only African Americans, but you also have Afro-Caribbean.
Yep.
And there you go, and first generation African as well. And so I definitely see that because of organizations like the National Black Nurses Association and other kind of ethnic organizations, that we are actually more intent on making sure that people understand that nursing is a viable career. And, it's viable in the sense that you have an opportunity to, I always tell my students that you can work with people from the womb to the tomb and everywhere in between. And so what career do you know that you can actually do that? And because you have such a wonderful skill set in being able to manage people and also being able to cater to needs of people, you also have this adaptability to be able to navigate the healthcare system. And so nurses, yes, we're talking mainly about nurses at the bedside, but you will see nurses in every area, imaginable and unimaginable. And so that's what, my organization, National Black Nurses, as well as the Action Coalition, when we talk about increasing diversity of nursing, because the patient populations need to mirror the healthcare workers to give us optimal health outcomes.
Thank you, Madam Chair. That concludes my testimony. Thank you for your service and testifying this morning.
Thank you for the opportunity.
Councilwoman, you're on mute. Oh, there you go.
Thank you. Councilwoman Brooks just alerted me. Thank you very much. I was steadily talking. So thank you, Councilman Green, for your questions. Thank you, Ms. Harmon. I don't see any additional requests for questions for this particular witness. So that being said, I just really want to thank you for your service through this pandemic and for all that you and your colleagues do. I can tell you, although I'm not a nursing professional and haven't had a whole lot of experience, with, needing nurses. The one experience I had was during childbirth, and I'll just say that as someone who had preeclampsia, it was very serious. And I know that it was the nurses who really came to my aid and who did the major lift, who did the hard work to make sure that both myself and my daughter were okay. So I have a great a debt of gratitude. And we'll never forget the work that was done over at Pennsylvania Hospital and from all nurses for all of the work that they do. So thank you so much. Thank you. And now we will have the clerk call the next witness here to testify.
Eula Davis.
Good morning, Madam Chair and Council. Good morning. And Council members and those that are testifying. I am Eula Davis, a registered nurse, educated and licensed here in the state of Pennsylvania. I've been a nurse for over 20 years and have worked in many different nursing roles. Most of my career, I held full-time nursing positions and periodically worked in PRN positions as well. Most nurses at some point in time during their career have worked PRA positions, whether it is due to a healthcare facility request for nurses or because a nurse requires extra money. Nevertheless, from my experience being a regular full-time nurse and working as a PRN nurse, PRN nurses' work is very challenging. The reasons are the PRN nurse usually receives the sickest patients on the unit. They do not know the other nurses they are working with, and thus do not have the team support during the shift. Also, these nurses are the nurses that usually are the last to get a break during their shift, if at all. As we have seen during this pandemic, nurses are on the front line, and they are sacrificing themselves for their patients. I believe it is only fair that if nurses can give of themselves unconditionally, whether they are regular employees or a PRN nurse, then it is only fair to help them when they are sick and in need.
Thank you. Thank you, Ms. Davis. Are there any questions for this witness, for Ms. Eula Davis? Councilman O?
Yes, to the witness again, thank you for stepping forward and sharing your experience with us. Thank you, Madam Chair.
Thank you. And Councilman O, before we call upon the next witness to testify, I know you had a statement that you wanted to read.
Yes, thank you very much. And I wanted to explain that the friend who called me, and she is in that 90% of the nursing population. She is a young Caucasian woman with 2 young children who, through some circumstances, ended up for a long time being the sole provider for her family, and thereafter has a huge financial debt and responsibility. She asked me if I would read her testimony in. I know her personally. I can certainly vouch she's a real person. She does not want to be identified. So thank you. This is her testimony. I wish I could appear before you in person, but I'm afraid. I'm afraid that if my employer discovered what I was advocating for, I would be fired. It's an easy thing to have happen when you're a nurse. There are so many little things in the course of the day that one could be written up for, found to be at fault for, that if they want to get rid of you, it's pretty darn easy to do so. Which is why I am writing you today. I'm a small person of little consequence in the grand scheme of it all. I go to work and collect a paycheck to support my family. But all of that can disappear in an instant. You see, I'm an employee but an employee without benefits or a union to protect me. I'm what's referred to as a pool nurse or PRA nurse. I sign up to go to work for a 12-hour shift, and if the hospital needs me, I go to work. If they don't need me, they cancel me, and I don't get paid. As long as things run smoothly, there's enough work for me to support my family, and the hospital benefits by having someone like me to fill in when their full-time employees are out sick or on vacation. Some would ask, why would you want this type of employment with minimal benefits and no protection? I answer, because I pick when I want to work. I'm not forced to adhere to a schedule that can be frankly debilitating, like day shift today, night shift tomorrow, and back to day shift one day later. It allows me to work around taking care of my children, being able to attend meetings at their school without having to scramble for daycare and babysitters to watch them while I'm at work on nights, holidays, and weekends. However, what happens if I become injured at work and can no longer work due to an accident or illness? That's easy, right? If I pull out my back trying to lift a patient, I report it to my manager, and the medical bills are handled through workers' compensation. But what happens if I contract a highly communicable disease and I become severely ill, even hospitalized or worse? I am left physically deconditioned and unable to work again for months or even a year. I have no disability insurance through my employer, no way to pay my bills or the insurance premiums that cover my care. Then everything begins to fall apart. If it was a relatively rare disease like meningitis or tuberculosis, I could reasonably argue that it was contracted at work. But what happens when it is deadly disease spreading quickly through the community like wildfires through Australia? I work in critical care as an ICU nurse. I currently spend my days caring for the sickest of the sick when it comes to the coronavirus. Theoretically, my employer tells us to minimize our time and exposure in these patients' room, but that's easier said than done. Sometimes I go into a patient's room and don't come out for over an hour. I wear my N95 mask, my face shield, my plastic gown, and gloves to the point I can barely breathe. And the plastic gown holds in all the moisture and short of breath, and the face shield fogs up and I can't see. I try to administer medications, tend to patients' bodily functions, and the machines filling in for various organs, like a dialysis or respiratory machine, all in an effort to keep these people alive. Many times these patients are already intubated, using a ventilator to deliver the much needed oxygen to their bodies. But sometimes they have not reached that point yet, and that is scary, because they often reach that point very soon. And that is one of the most dangerous times of all when caring for a COVID positive patient. As a nurse, I'm required to be present in the room for an intubation of my patient. It's really like something out of the movies. Anesthesiology shows up, all dressed in gowns, PRs, but only one enters the room. During the process of intubation, we open up the patient's airway, and this is the point when all that stuff in the person's lungs is aerolized, creating a deadly stew whirling through the air around me in a small, cramped room. I have to stay in that room even after the others have left. I have to manage sedation and patient medication through pumps and IVs until I reach the appropriate stage where the patient no longer is aware, but is still able to have a beating heart. So what happens if I contract COVID-19? Did I get it at the grocery store or did I get it at work? I will have to fight for workers' compensation from my deathbed. It may come to that. We all like to believe that people will do the right thing. It's what keeps us going most of the time. But when big money is involved and insurance premiums are at stake, it isn't always clear to those in charge of what the right thing is to do. Do they fess up and acknowledge this worker-related injury, or do they do what's right for the institution and the bottom line? It is the same story that has played out for decades in this country. Often it takes a horrific tragedy like a fire in a sewing factory where all the doors are locked to keep the workers working. There may not be that monumental moment in this current pandemic, but trust me, it will be played out over and over in single tragedies faced by individuals all alone against the powers in charge. A single tragedy where a healthcare worker braving one of the scariest events in our lifetime is left by the side of the road. No one with safety, alone with no safety net to help, to lose their home, their life savings, and possibly their life, and nothing to help with those left behind. So I write you today to consider what I have to say and urge council members to support Councilman O's bill number 200306. Use your best judgment to make sure everyone knows what is the right thing to do. You are my voice. You give me an inconsequential minion legitimacy in a world that would otherwise look right past me. Thank you for all that you do and stay safe. Sincerely, Paul Nurse. Thank you very much, Chairwoman.
Thank you very much. Thank you for reading that very powerful testimony. Does anyone on the panel have any, or does any of the members of council have a comment? And if not, we'll go to the next witness to testify. If we can have the clerk call the next witness who is scheduled to testify.
Stephanie Borelli.
Hello.
Hello. Please state your name for the record and begin your testimony.
Thank you. My name is Stephanie Burrell.
Mm-hmm.
I'm a nanny in Philadelphia. I'm a member of the Domestic Workers PA chapter. And we are a member of the CREW, Coalition to Respect Every Worker. Thank you so much for having me. Bill number 200306 by Councilmember O is insufficient in its expansion of the Philadelphia Paid Sick Day Ordinance. We need a bill that supports more than a subset of healthcare workers, and we need a bill that includes at least 14 days of paid time off during a declared pandemic or epidemic event. This pandemic has revealed shortcomings in Philadelphia's Paid Sick Day Ordinance, as well as our statewide and federal safety nets. As is, thousands of workers in Philadelphia are forced to decide between public health and making ends meet. This is cruel and unjust. Today, I represent my nanny and home care worker colleagues that cannot attend the committee hearing because they are at work. As we speak, they are taking care of your children and the children of these healthcare workers in question. We do the work that makes all other work possible. This demonstrates that we too are essential workers, and that any legislation to address the disparity in our existing paid sick day ordinance needs to not only include the healthcare workers in Councilmember O's bill, but also those of us, including undocumented workers in the informal economy. More and more Philadelphians are waking up to the fact that the mayor and many in city council leave behind those of us inflicted by poverty, many of whom are Black and brown. This is reflected not only in the city budget, in which you fund the police instead of our public schools, arts and culture, services for the unhoused, parks and rec, and the public health office, but also here, where thousands of workers continue to be excluded from the paid sick leave ordinance. As the Committee on Public Health and Human Services, you have an obligation to your constituents to promote public health for everyone. You can do this by alleviating the burden which is currently placed on us to decide between endangering others with a deadly disease or earning an income. We need an expansion that includes more workers and at least 14 paid sick days so that we can all do our part to keep Philadelphia safe in the event we contract a communicable disease during a pandemic or epidemic. Thank you.
Thank you for your testimony. If we could now, I believe Councilman O now has a question for the witness.
Yes, thank you very much, Chairwoman. I appreciate your testimony and the points you raised. That actually has been addressed in Councilmember Brooks's bill, which you will also have an opportunity to testify on. In the scheme of things, what happens is this bill will be voted on. And the other bill will be voted on sometime in the future. Are you testifying in opposition of this bill?
I will not let you pit me against other workers, so I will not answer that question.
Thank you very much.
Okay, if we could have the clerk call the next witness, unless there's any other questions, if we could have the clerk call the next witness to testify.
Amanda Shumko.
Hello, and good morning, Chairperson Bass and members of the committee. My name is Amanda Shumko, and I am here on behalf of the Deputy Mayor for Labor, Rich Laser. I appear before you today to testify in opposition of Bill number 200306. As we understand it, Bill number 200306 would amend Chapter 94100 of the Philadelphia Code to make certain healthcare employees and hospital pool employees eligible for compensation for lost wages and medical expenses in the event they contract a communicable disease during a pandemic or epidemic event. This could be a valuable addition to our law since the Federal CARES Act has failed to provide this benefit to our healthcare workers who risk so much to provide care during COVID-19. However, too many healthcare workers may be left out of this bill, such as part-time workers, home healthcare workers, and possibly temporary workers. These workers overwhelmingly lack health benefits compared to their full-time counterparts who do the same work. It has been well documented that in terms of health impacts, mortality, and economic security, the COVID-19 pandemic has had a disproportionate impact on people of color. About 9 in 10 home healthcare workers are women, and people of color make up about more than half of the home healthcare workforce. While some employees would see expanded benefits, many would not. As it is written now, our office cannot support this bill. However, we are open to working with council to bridge some of those gaps. Thank you for the opportunity to testify, and I'm happy to answer any questions the committee may have.
Thank you for your testimony. I see that Councilman O has a question, followed by Councilmember Gim. Councilman O.
Thank you very much, Chairwoman. I am familiar with the testimony you just read. I read it last night. There has, however, been an amendment to the bill, which includes pool workers, union workers, part-time workers, and home healthcare workers, and everyone else. That's a healthcare worker. I think that part is not up to date. The other part, again, however, is I get the part about it can be better. I understand the part about it can be broader. I got that. However, kind of my point is that when I wrote the bill, it was about healthcare and the public at risk in a pandemic where the healthcare capacity was at stake. And so I've made the amendments as it was brought to me by people, to say, hey, you forgot about these people, what about these people? And so I've made these amendments as they make a lot of sense to me. What doesn't make sense to me is this, that we are past due getting this done. And to say that we are going to forego the entire summer and not provide healthcare workers protection so that we can improve those protections later and introduce protections we can do that anyway. And so what I'm not clear on is why it is kind of like either or. Like, we can get this done, and if there is a broader, more inclusive bill, that's another matter. And if that passes, that will supersede my bill. But to say that we should not deliver these protections, to imply, and I hope this isn't true, that the mayor is going to veto these protections through the months of July, August, September, and whatever for this very large group of people in the middle of COVID-19, that's something I don't understand. I know you can't answer that. It's really unfair. I know you're reading the mayor's statement. If you have something to add, please. But if you don't, I think we all understand you're reading the statement of the deputy mayor.
Sure. I think I can add that we'd be happy to revisit and take a look at the amendments that you're talking about. It's possible that we haven't had the most up-to-date version. Because like in Rich's testimony, we are happy to circle back and work with council on this. I don't think it's that we're either or, right? We really want to, in this moment, get this right, because it is really important that as many healthcare workers as possible get the benefits that they need, especially in this moment. And I think that is what we're trying to get out in his testimony. I don't think that I'm putting words in his mouth, but sure.
Okay, so I'll conclude with this. The house is on fire. The fire engine got there while the house is burning down, and someone says, we can get a better fire truck if we go back and work on it. I'm just saying that may be true, but for me, it's a timing issue. Like, we cannot go back and work on something only because we're out of time. If this isn't voted out of committee today and then waived the first reading, it won't be voted on at our last session, which means the entire summer, there's no protection. Then we roll into September, maybe October, and then you have to do regs, you have to go through all that for something that is really, really very expansive. Once you get outside of like healthcare, you start going into lots of other areas, which is fine. That's a whole nother bill, a whole nother package, a whole nother thing. So in the meantime, on the front line, you have healthcare workers that are not covered. That's my disagreement, but I understand, and thank you for your testimony. Thank you very much, Chairwoman.
Thank you very much, Councilman. And now we have a question from Councilwoman Gim, followed by Councilwoman Brooks.
Yes, thank you so much, Madam Chair, and thank you, Ms. Shimko, for all your work in upholding labor rights and labor standards. It's been a real pleasure to have a Department of Labor that really thinks very broadly about the health and well-being of workers across the board, and really has a bold view and vision for that. So I just wanted to open by thanking that. Have you had discussions with the bill sponsor about enforcement and regulations on this particular bill?
We have not.
Okay. Do you have a sense of how you would enforce this as written? Like, do you feel like that's clear? I mean, part of what we want to do is all of us we are all working under a sense of urgency. We are all working under a sense of like real need and care for essential workers, especially healthcare workers, but also all essential workers, including many of whom have, put their lives on the line to keep our city running. But could you talk a little bit? I'm sorry, I'm hearing an echo. If anyone can mute, that would be really helpful. But if you feel like, do you have a sense of how the enforcement would work as written, and do you feel like it's clear?
Well, so I guess we have a sense of how it would work. Because it's amending the sick leave bill, we would be following our sick leave process for how our sick leave complaints come in. It would, in this instance, because these cases would happen rather quickly, and we'd want to make sure that workers had access to the protections faster than the sick leave process provides for, there'd be some benefit in potentially creating new enforcement language for this specific section of the bill. Right now, to close a sick leave complaint, it can take us anywhere from 2 weeks to 3 months. And when you're talking about someone's health, we wouldn't want to be in the 3-month range. And obviously, this is only when hospitals are violating. This isn't when a hospital simply agrees to follow the law. But all too often, we have hospitals in this city that do not follow the law. So.
Yes, we are fully aware of that. Can you explain what might happen when a nurse works for multiple employers across hospitals? Do you feel like that's clearly laid out in the bill?
At this point, I'm not sure. My background is working for a nurses union. I was a staff attorney and staff rep for PASNAP, and some of the anecdotal knowledge that I have is that per diem nurses tend to work for multiple hospitals in order to get their close to 40 hours a week and be able to manipulate their schedule. So there would be some question over which hospital was responsible for the cost of the medical care that we talk about in the bill. And it might be difficult with hospitals pointing their fingers at each other and saying who was responsible.
Right. Okay. And then how about in terms of, similarly, I think that's leading into the question that I had, how would the medical expenses reimbursement actually work? Do you feel that that's clear in the bill as it's written?
Not at this point.
Yeah. And do you think that this is can you speak about, have you been working with the sponsor of the broader paid sick leave bill, Councilmember Brooks, on her bill?
We have.
And have you been working through some of these more complicated issues with that sponsor?
We have. It would be untrue to say that we've solved all of them, but we are diligently working on figuring out how to make this process fast enough and how to make the enforcement of it as effective as it would need to be to capture the health related, the way that sickness moves, right? It's faster than we are. So we are trying to work on that right now.
Yeah. So you would agree that this is a pretty complex process that needs some thought before moving on the legislation, and has needs the work that your office has been doing on understanding paid sick leave, how it works across different institutions, and the complicated nature that healthcare workers may have when they work for multiple employers. Is that correct?
It is.
Complex process.
It is. And I would add, being on the front lines and during this pandemic, it hasn't just been the people on my team, but also myself taking phone calls. It's really disheartening to tell workers that, no, in fact, you don't get this because of a technicality, or no, actually, you're misreading this and this isn't how it works. People are desperate isn't the right word, but it's sort of escaping me right now. But people are really in need of these protections, and to get on the phone with someone who might just miss this because we got a word wrong, it is really disheartening to our office, and we want to do our best to make sure that we're including all the people that we're intending to include.
I mean, I think what I'm hearing from you, that we are not, this is not about whether one bill is bigger or better or anything than another. It's not even just about, what workers get covered, but it's actually recognizing that the technicalities of this work require a pretty focused approach towards this legislation. I mean, as you know, and I complained loudly to your department, we've had a paid sick leave bill on the books for 5 years. And when restaurants closed and some of the most prominent restaurateurs in the city actually refused to do the paid sick leave, work for employees, it became very clear that legislation needs to be properly processed along with a concept of what enforcement can look like in order for workers to truly be protected, rather than just to move a bill through. Is that correct?
Yes.
Thank you very much, Madam Chair.
Thank you, Councilwoman, for your questions. I actually have a question, and it goes back to something Councilwoman Gum said, and that the administration had been in touch with Councilwoman Brooks regarding her bill and working through some of the kinks on it and working together. Is that correct?
Yes.
And earlier on, the Councilwoman asked you if you had been working with Councilman O on his bill, and that response was that no, that the administration did not reach out to Councilman O to try to work through the kinks on his bill?
We have not worked with Councilman O on this bill, no.
Can you tell me why? Why was there a preference from the administration for one bill over another?
No. I don't exactly know when everyone in the administration became aware of the bill, but it was late in this week, and we just hadn't had the opportunity to.
Councilman, I'm just going to, I see you, Councilmember Brooks, but I want to ask Councilman O as to the date of the introduction of your bill.
Unfortunately, I don't remember. I thought I introduced it sometime in April.
Okay, but there's been some time.
It's been some time. Yeah,
Okay.
I think I drafted it in. It was introduced, I thought, in late March or early April. I had that conversation somewhere in mid-March, I think, but it could have been like into the middle of April. Honestly, I don't remember.
Okay, thank you. I guess the point that I'm making, that clearly it gives the sense that there's a preference and has been a bias for the bill. And I see you, Councilman Brooks. I'll recognize you if you want to add comment in, but it does give that appearance. And if you want to explain otherwise, and that's fine. But I'm just saying that the idea that the administration is working on one piece of legislation, and you have a very similar piece of legislation, and you're not working on that one. It doesn't look so great on the surface to me. Chair recognizes Councilwoman Brooks. If you'd like to ask your question and also provide additional detail on that.
Sure. I just want to clarify that I think both of our bills were introduced on the same day. I think it could have been like May 1st. And Councilman's bill was able to have it way before mine. So that's one thing. And
well, let me pause right.
Finish my whole statement in response.
Certainly.
In response to our work with administration in us drafting this legislation, we reached out to multiple unions, including PASNAP, 1199C. We had a union conversation with multiple unions. We also reached out to small business owners to have a conversation about the gig economy, undocumented workers. So we've worked with a lot of different stakeholders in crafting this legislation. But for the record, the administration did not reach out to us. We reached out to them as we began to craft this legislation to make sure that it just doesn't get out of committee, that once it hits the floor, when it's ready to be implemented, it's ready to roll without any complications. So we also reached out to the law department. So we've worked with every possible legislative branch that we could to make sure this bill is still sound and able to move forward. I didn't directly work with Amanda, but I spoke directly to Richie Laser about this. And we've been working through this step by step with multiple revisions from the business sector, as well as multiple revisions that we got from unions, and even including unions that are not particularly covered by this. So we've done a lot of work to make sure that it's as inclusive as possible. So I'm not really sure why Councilmember O did not have a conversation with administration, but that's just the way my office decided to go about drafting this legislation.
So, let me just say this. So the question that I was asking, or the comment that I was making, didn't have anything to do with, as a negative against your bill or your office. The point that I was making is that it gives the appearance that the administration, which obviously we always want to work with the administrations as legislators. We always want to work with them to try to find common ground, to try to have their approval when possible on a piece of legislation. It has the appearance that is not what has happened here. Regarding the fact that Councilman O's bill came up first, I do want to note for the record that, Councilwoman, you and I did have a conversation about your bill. I expressed concern. This was probably about a month ago. The reason this bill has not been heard, and there's a lot of chatter on social media about it and so forth, but just to be clear and for the record, the reason this bill was not heard is that we had some concern, I had some concern that you would not be able to get your bill out of committee with passage, and I spoke to you about that. And at that time, I asked you, Councilwoman, why don't you have some conversation with some of the opposing forces, if you would, and then circle back. And when you circle back, we'll schedule your hearing. And that is exactly what happened. So I just really wanted to be on the record about that as well. Okay. And if you want to go ahead and ask your question, that'd be great.
Sure. I have some questions based on Council Member Gim's question. I also noticed that there's no severability language in this legislation. Is that correct? And is that something you can speak to, Amanda?
That's correct. We usually defer to the law department on their suggestion about severability language, but it's always important to have it. We don't want some new law to pass and have this whole thing be deemed unenforceable because it's missing.
Thank you.
Okay. I see Councilman O has another question. Councilman?
Thank you very much, Councilwoman. I just wanted to point out that, and I got a text from my staff, that May 1st, we introduced the bill. We reached out to the administration to say that we would appreciate their input, any amendments, any concerns, things like that. I will say that there's a couple things. As I said, I've been on the board of two hospitals. One's Nazareth Hospital in the Northeast, and on the Health and Education Corporation for Hahnemann University, way back when during the whole Allegheny debacle. And so I am familiar from that side with certain aspects of the operations of hospital. I did not know anything about really like home health care, that whole thing. I've kind of learned about it a little bit. My sister has severe Down syndrome, and so she has someone coming to her home and all that. So I'm familiar with that, and of course with my mother being older. But I also was involved as an attorney with employment law and workers' compensation. And so I'll just basically say that we write bills, we write legislation, we don't write regs, we don't write all the that goes to the administration. Some things are difficult to enforce because there's no structure around it. Healthcare, to this extent, is relatively easy because there's an employer that's regulated by lots of rules, laws, and things like that, and they're subject to many things. And I'll say that some of the issues that are concerned, it's just going to be a concern. If you are a worker out there in the public, did you get COVID-19 serving food, or did you get it on the bus going home? This is, if you have multiple employers, if you have a job here and then you do a little gig work over there, if you did a little part-time work over here. So how that is resolved, if it comes to it, it's resolved not by the parties, it's resolved by the courts. We have a system to deal with that. And so that has always been dealt with when it comes to the issue. But it's not like you're going to write a bill to say that, if I work for a certain employer, that if I get COVID-19, that it's just set that I got it on the job. Those are going to be issues. So part of it is with the presumptions and other things. So what I'm saying is, when you're for example, a nurse or in the healthcare, your time is overwhelmingly with the employer, for the employer's interest, exposed to a disease, as opposed to someone who can work from home or can exercise social distancing. So I'm not saying that that this is not an important issue. I'm saying that it's just going to be an issue, however we deal with it. And so I don't think there's any more that I'm going to be able to do with this bill that in regards to Thank you, Chairwoman.
Thank you, Councilman. Okay, and seeing that there are no other questions for this witness, the clerk will now call the next person to testify.
Madam Chair, that concludes our list of witnesses.
Okay. Is there anyone else present in this hearing whose name we have failed to call and that wishes to offer testimony on the bill being considered today? And seeing that there is none, I want to thank all the panels and witnesses for their participation today. We value your opinions and now invite all panels and witnesses to please disconnect from the meeting before we go into our public meeting. We will now pause the proceedings briefly as multiple participants will leave the meeting. Thank you very much. Okay, this now concludes the public hearing of the committee. We will now go into a public meeting to consider the action to be taken on the bill before the committee today. And please stand by for a moment. Oops. I want to thank everyone for their patience. We're ready to proceed. And I believe I see that Councilwoman Gim has a comment before the vote.
Yes. Thank you very much, Madam Chair. And I want to thank you for your leadership. These are very, very difficult times. And I know that you've got so many things moving, and I appreciate your attention to very important and urgent issues. I will be voting in favor of this bill. I do, though, ask that that we consider how we're going to think about its recession once or particularly given the fact that Councilmember Brooks has a bill that I think has been procedurally has had more review and engagement on it. And would cover a lot of the areas that Councilmember O already has. And again, I think it's a good faith to put forward legislation that actually protect people and is, all of us have the intention of doing the protection. All of us have also been on committee for a long time, and it's complicated. It's so hard to get actual laws that we have on the books enforced. And I know we all share that. And some of my frustration, honestly, is that it's so difficult, especially with large institutions or with recognizing that so many people don't work for a single employer anymore. They are divided amongst multiple employers, that they're working part-time here and have jobs here. And so the legislation crafted does need to be the best that it can be, and that requires rigorous review of our city agencies being willing to enforce, as well as, review by law and a partnership with council, of course. And I want to thank, certainly the bill sponsor for having the right intentions. I want to thank the leadership of this body for putting workers first. But I do think that, I want us to be working in good faith, and that's why I will put my vote towards this. But I do want to put on the record that we have a hesitation, because I want us to make things work, because it is so hard on so many people right now. And people need us not only to do things, but to do things well right now. And I know you are in agreement with that, Madam Chair.
Yes.
But I want to thank you for your leadership. And I hope that we will give Councilmember Brooks the same level of good faith effort when her bill is heard in this committee later. Thank you.
Thank you, Councilwoman. I certainly give all of the members of this committee fair and equal treatment. And as I said before, just to reiterate, the reason that Councilwoman's bill was delayed was that I did ask her to circle back and talk to some of the folks who were against her bill to ensure passage out of committee of her bill. So I just want to be on the record for that, just to be clear that, we're all trying to make sure that we do right by workers in the city of Philadelphia and really touch as many people as we possibly can in doing the right thing. I see that Councilman Thomas has a question and a comment before we vote.
Thank you, Madam Chair, for recognizing me. I appreciate it. Am I coming in clear?
Absolutely.
Okay.
Oh, wait, hold on. Councilman O, can't hear you.
I'll try.
Can you hear? Okay.
Am I coming in clear now?
Very good. Yes.
Okay. So, yes, thank you, Madam Chair. I appreciate it. I first want to start with the question. We do have another hearing scheduled. Is that correct?
Say again?
We do have another committee hearing scheduled. Is that correct?
Yes, for June 22nd. That's correct.
Thank you, ma'am. Okay, so while I appreciate you reaching out and doing the due diligence to check in with me to see where I was at with the bill, you're the only person who reached out to me. So I would like to also be considered as it relates to compensation, and when folks are reaching out to people. We are all in the position right now where we have received probably 20,000 emails over the last 10 days. So for me to receive an amendment this morning about the bill that we're looking at today put me in a very difficult position right now to kind of take a vote on something. So I'm just going to kind of ask folks as they do their due diligence when it comes to bills to make sure that everyone on the committee is included. And also with the difficult situation that we're facing with COVID that forces us not to necessarily walk next door like we would normally want to just kind of keep that in mind. So I appreciate everyone's effort today here with this bill. I want to be honest and say Councilmember Brooks has reached out to me about her bill. But unfortunately, a lot of the information my team and I had to hustle together this morning to put us in a position to make an effective vote that what we feel like would be best for everybody. So I just wanted to put that on the record because I was listening to a lot of what's going back and forth. And I, too, want to make sure that we're doing what's best for the citizens of Philadelphia. Thank you.
Okay. Thank you very much, Councilman. And Councilmember Brooks, Heenan had a question. But before the Councilman goes, I think Councilman O wanted to respond to Councilmember Thomas.
I just wanted to apologize. We're all, because of this, I can't get into my emails. I can't hear voicemails. We got some stuff back and forth, quite frankly, from some of the unions and things. It was, I think, about 10:30 at night when I got it. So I apologize. You're absolutely right. And I should have known better than to, just kind of have that go out. So I apologize to everybody on this committee.
Thank you. Thank you, Councilman. And Councilman Heenan would like to be recognized.
Thank you, Madam Chair. I want to thank you for the tremendous courtesy and patience and due diligence you've put forth, in both of the bills, especially scheduling a hearing towards the end of our session, all right, that deserve the respect of a more inclusive, for the record, or more inclusive, leave legislation. For the record, I am a co-introducer and support the Brooks legislation. We've been working on it for a long time together with the administration, stakeholders, and other members of the committee. And just want to recognize your leadership in this committee and making sure that it has the hearing that it deserves and the conversation it is warranted, especially during these times that are unprecedented and we have never seen before. So I want to say thank you for that, and look forward to, even if this bill gets out of committee today, look forward to further in this discussion, because it is a discussion that needs to happen, and it has been a discussion that has been taking place, and I'm glad to be a part of it. And I just want to thank you for your leadership, and all members of this committee as well, for taking it as serious as it has been. So thank you so much.
Thank you, Councilman. And I do want to say that, we are operating in strange times now, and we're doing things so differently than what we're accustomed to. But I did want to say one thing as we proceed on the vote on this bill, and that is that it's okay for us to have a difference of opinion, but we don't have to be disagreeable with one another. We can support this bill, and we can support other bills that are similar to it. It doesn't have to be me against you, against someone else. And I think particularly as we present ourselves to the public, and the perception that one council member is mean or evil or bad versus another council member and the work that they're doing that is good over evil on this council, I thoroughly reject that, because I know that we're all working really hard to try to do things. And maybe we might not see exactly eye to eye, but I think that there is a lot of commonality on this council in terms of our thought process. So I just really wanted to say that it doesn't have to be an either or sort of situation. We can work together. We should be communicating as much as we possibly can. And, where possible, reaching out to our colleagues and asking, how they feel about a particular piece of legislation. I get that. And at the same time, as we all know, as members of council, our emails have pretty much been inoperable. Even though the folks who are sending out, like tons and tons of emails prevent us from getting from the people who need the help the most. So I would just urge us to try to, work together, stick together, stay together, and try to get some good things done for the city of Philadelphia. So that being said, I'd like to call for the vote, and Chair recognizes Councilman Heenan for a motion on the amendment to Bill number 200306.
Madam Chair, have we convened the public hearing and have gone into our public meeting?
We have, but for the record, I will go ahead and read the statement to indicate that.
Madam Chair.
Yes.
Madam Chair, I'm sorry, this is Councilman Thomas. Before you do that, I just want to let you know that for some reason I got kicked off, but now I'm back on.
Welcome back. And that's no problem at all. Welcome back. This concludes the public hearing of the committee, and we now go into a public meeting to consider the action to be taken on the bill before this committee today. This is public meeting to amend, and we are amending bill number 200306. The chair recognizes Councilmember Heenan for a motion on the amendment to bill number 200306.
Thank you, Madam Chair. I move and recognize that there's been a motion and amendment submitted to bill number 200306. It has been circulated to all members, and wish it be moved to all committees.
Second.
Okay, it has been moved and properly seconded the amendment to bill number 200306 be approved. All of those in favor of this motion will signify by saying aye.
Aye.
Any opposed? Okay, the ayes have it, the motion carries, and the amendment to Bill number 200306 has been approved. The chair recognizes Councilman Heenan for a motion on Bill number 200306 as amended.
Thank you, Madam Chair. I'd like to make a motion that Bill number 200306 as amended be moved out of committee with a favorable recommendation with the rule suspension as to be heard at our next session of council.
Second.
It has been moved and properly seconded that Bill number 200306 be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council. All of those in favor of this motion will signify by saying aye. Aye. Any opposed? The ayes have it and the motion carries. And this concludes the business of this hearing. I want to thank everyone for your patience and attendance today and for the spirit of cooperation and working together. Thank you very much.
Thank you.
Everyone have a great day. Thank you.